You're watching CTOM TV. Knowledge is power.
How can a virus like HPV cause cancer?
Excellent question. So, as we mentioned, we've explained part of the mechanism. It's access to these stem cells that the virus preferentially infects. So, I'm not sure if you recall, but we discussed the different genes that it has. HPV has 8 genes.
Looking at my notes here. Yes, 6
H
early
genes.
genes
Right.
and 2 late genes.
Right. So early gene 7 binds to a tumor suppressor gene called the RB, retinoblastoma gene. It is a tumor suppressor, so it plays an important role in inhibiting the cell cycle and many different functions. I won't get into it, but this E7 protein from the virus, the early 7, inhibits this genetic signaling pathway called RB. And then the E6 protein inhibits a different tumor suppressor gene called the P53. And the P53, as we all know, is called the guardian of the genome. It protects the genome from cancers. And so both of these genes are commonly inactivated in cancer.
What was the first one with the E7?
RB.
RB.
Retinoblastoma.
Okay, so RB and P53 are helpful in that they suppress the growth of tumors in the body.
They're tumor suppressor genes.
Okay,
yes.
And unfortunately, the E6 and E7 genes that are involved in HPV shut this process down.
Right.
Okay, got it.
So now this opens up another important point. A lot of our patients, when we do inherited genetic testing, we see that they have a germline or inherited mutation in either RB or P53. So if these patients already have a genetic mutation and then they get exposure to even a weaker strain, or even if their immune system is fighting it off, they're going to have an increased susceptibility to oncogenic transformation from HPV.
Sure, the development of cancer.
Now, we do see these 2 genes, E7 and E6, in normal tissues that are not cancerous. So just their presence there alone does not cause cancer.
Okay.
It can. There's a multitude of factors, but obviously in patients who do have HPV-associated cancer, they probably have mutations in these genes previously. They could have co-infection with other variants, other different viruses. They could have a suppressed immune system. There could be a variety of different factors going on here. So it's not just these 2 genes, but that is the mechanism of how they work. They downregulate these important integral tumor suppressors. So very important.
Yeah, so they stop your body from doing what it could do to prevent cancer.
Right.
Got it.
Right.
Hence, if you can have a vaccination,
you're that much further ahead of the game.
Right. Yeah. Yeah.
So the HPV infection causes a very unique form of cancer. I won't get into the different cell types and so on. Typically, it's associated with a squamous cell subtype versus an adenocarcinoma.
Okay.
But when HPV causes head and neck cancers, these cancers usually have a much better survival rate than HPV negative head and neck cancers.
Okay, you're waiting for me to ask you why. I can't wait to find out.
Yes. So one of the things is when you get infection with an HPV agent, you have a lot of what we call tumor-associated antigens. And an antigen is what we call an antibody generator. That's the term, antigen antibody generator.
So this is good.
Yes, so that's antibodies are the protectants of our immune system.
Okay.
They target foreign invaders and tumors and so on. So when HPV infects and causes cancer, you have a high level of these antigens, and this tweaks the interest of the immune cell system. And more importantly, the location of HPV infected cancers is really a key to their the way they work.
Okay. The location of
of HPV associated cancers. Now, do you remember where they infect?
Well, we have cervix, throat, anus.
Yes, but more
penis,
importantly,
oral,
what
larynx.
part?
Oh my gosh.
The basal,
Okay.
undifferentiated stem cell basal area.
All right.
That area typically has a high amount of what we call tumor infiltrating lymphocytes, TILs. They're called lymphocytes. They're CD8 positive. If you recall back, we've discussed this a few times where we have the tumor infiltrating lymphocytes that attack the tumor and get into the tumor and attack it, but are disabled by PD-1. And then we have the CD4 positive immune cells, which are called the Tregs. And those are T cells that go in and actually supply the cancers with food and growth factors and different things. So Tregs bad, TILs good.
Okay.
So the area that HPV infects, because once again, it only affects certain cells, the basal cells, typically has a high amount of these TILs. So it's kind of a worst case scenario. It's not a smart evolutionary process of the HPV. And it may change its evolution. Yeah, lucky for us. It may change its evolution. And this is probably why it hasn't killed us yet.
Right.
Because it will if it has a chance. So the location of HPV positive head and neck cancers is typically the base of the tongue and the tonsils. And this is an area that contains a lot of lymphoid tissue.
Okay.
And so this is the area that has these CD8 positive immune cells. Lymphoid tissue is high in immune cells.
Okay.
So because of that, that opens up a particularly favorable response to standard treatment.
Okay.
And also opens up the door for immunotherapy.
Okay. So that's kind of the silver lining.
It's the Achilles heel of HPV infected cancers.
Right.
And so they typically do better.
Right. Because it makes your immune system pay more attention.
It's primed already, ready to go.
Got it.
It's in an area that has immune cells.
Okay. If you've had the vaccine already, does this make it even easier for the immune system?
Yeah, because it's going to have the antibodies right there.
Okay. Got it.
Now, that's kind of a redundant or a moot point, because if you have a strain of HPV that is causing you cancer, you obviously haven't been vaccinated against it.
Against that one, yes. Okay, what I was wondering is, does having, even kind of close to the mark, like being
off-label, we call that.
Okay. But no, it doesn't really help.
It can.
It can.
Yeah.
Oh my gosh.
Yes,
okay.
it can. And that is something that's really hard to quantify and qualify.
Okay. Just because we don't know enough
yes,
yet?
we know that. We do know. I mean, these strains are all very similar. So whether there's something in that antibody that we've created that is going to affect us against numerous strains, it can happen. Yeah, definitely.
All right.
Yes.
But again, back to
it's like flu shots.
Get the vaccine.
You have some off-label protection. You may not, if you get the flu shot and the wrong strain comes, they predicted the wrong strain, for example, you may still have some protection against that, and you'll have a reduced course of infection. Right. So it's the same with HPV.
Okay.
It's similar to most other viruses.
Okay, that makes sense.
Thank you for watching CTOME TV. Subscribe below and stay informed.